Welcome to Oral Arts Dental Lab. We're very excited today to have Dr. Chris Salerno with us and Dr. Josh Austin. Dr. Chris Salerno practices out of New York, and he is the editor-in-chief of Dental Economics magazine. Dr. Josh Austin practices in Texas, and he is a contributing editor of Dental Economics. So today we looked around the lab, we saw the technology, and met the people. Tell me, Chris, what was your experience of the lab today?
I loved how much pride people had in the work that they were doing here. You know, that is so contagious. So obviously you're going to see really high-tech things when we come to see this lab. We know this is a lab that's able to compete and offer dentists high quality, but also at a very reasonable price. So we can, make our day-to-day make sense, right? But I was just so enamored with the passion that these people had. Everyone we met just was so excited about the job that they do, taking care of the patients. Patients they never meet, but they're just so excited to be involved with that process.
Thank you very much. What about you, Josh?
Well, one thing I noticed is that every time you introduced us to somebody, you told us how long they had been here. And a vast majority of them had been here for many, many years. That's also impressive. I thought it was great to meet the people that are going to be handling the dentistry that I send in, and they're going to make the restorations that I send in. We sat with a guy who marks all the digital margins on the digital impressions, and he was actually sitting there with a lab pan from one of my cases, and we pulled it up and looked at it. And so now, next time I send in a scan, maybe where the margin's not as clear as it could be, I'm going to be picturing his face in my head and imagining him like feeling disappointed in me when he sees that. So it gives me a little extra incentive and a little bit of ownership in the stuff that I send in so that I can get the best stuff back.
One thing that made me think of, today you saw some usages for the intraoral scanner that maybe you hadn't previously been utilizing with the lab. Can you describe that process that you saw there?
Absolutely. So we talked about occlusal splints using an intraoral scanner, which I have not been utilizing it for. We talked about screw-retained implant crowns, Modulus, which I think is really great. The more I can do Modulus, the happier I am. And so I think it's opened up my eyes as far as the types of cases that I can send into Oral Arts and work with digital workflows on, which makes my life easier the whole way around.
Yeah, we do have a printer where we can print those models. So instead of just doing crown and bridge, he can send those full arch cases, and we can do any kind of splint or a cast partial or a flexible partial, all from a digital model, which is much more accurate. You don't have the tissue compression and the pulls and all this other stuff you deal with on a regular impression. One thing I wanted to hit on was just give some advice. You guys are looked to as leaders in our industry in terms of education, especially to younger dentists that are graduating from school. Everybody knows who you guys are. Tell me tell the audience what advice you would give these younger dentists who, when you're in school, they tell you which labs to use. You have no idea what the lab is, who to talk to. You can't deal with them. When you come out of school, it's a whole nother world. I mean, you have to learn how to be a partner with the lab. So what advice can you give to these younger folks who they're not used to that dynamic of dealing with the lab?
I'm glad you used the word partner. It really is a partnership. And it's one that we don't get a lot of exposure to in dental school. Absolutely right. We often have little to no experience with an assistant, someone that we're going to use every single day. And yet the laboratory work is, honestly, it's more valuable as a dentist. I need to have that control and that partnership with someone directly when I'm taking care of my patients. So my advice is very simple. If you're able to physically go to the lab, take a tour like we did today, meet with the people that are going to be handling your work, absolutely take advantage of that. And if a laboratory for some reason doesn't welcome you with open arms for that tour, there's something wrong. Right. The other thing I would say, and this goes without saying, even if you can't physically go to the laboratory, is just pick up the phone and talk to them. Have a conversation. I've unfortunately had experiences in the past where I wanted to speak to the person who I was sending my impressions to, and I said, "Hey, I'm looking at this margin, and what do you think?" And they were like, "Why are you calling me?" And that's the wrong approach. You should absolutely have someone that is happy to be on the phone with you and having that conversation. That's how you really develop that partnership.
I appreciate it. Chris, one thing that he mentioned was visiting the lab. We welcome anyone to come to the lab. One of the things that I want to mention is we do all of our work here in the United States. 35% of the lab work is done now overseas, so not only are you not talking to the people who even have your cases, you can't go and visit and see the people who do the cases. So thank you for bringing that up. What about you, Josh?
One thing that I noticed was everybody that we talked to, every certified dental technician that we talked to, and there's a ton of them here, more so than I've seen even at bigger labs than this, is the amount of knowledge that they all had. And they all carry an immense amount of knowledge that far exceeds my knowledge on the laboratory process of things. But that knowledge will help me in my clinical practice of dentistry. And so, look at your laboratory technician and your laboratory as a valuable part, a colleague of yours, because without their input, it would be difficult to practice the highest level of dentistry. So I've been very much impressed by the number of certified dental technicians here, and it's been eye-opening as far as their knowledge and passion for what they do.
Yeah, absolutely. Thank you, guys. Thank you so much for being here. We've had a great visit together, and we wish you the most success in 2016.